you get pain that's on the front side of your shoulder, or even pain that goes down to the pinky side of your arm? You may even have some numbness or tingling in the hand. Hi, I'm Dr. Catherine Price, and I'm going to share with you trigger point release of the pec minor muscle. The pec minor can be a culprit to pain on the front of the shoulder or on the ulnar side, which is the pinky side of the arm. And this is also a muscle that's involved in what is called thoracic outlet syndrome, and that's where that muscle presses on the brachial plexus, which is the nerve bundle that feeds the arm. So if you deal with a lot of numbness and tingling in your hand, sometimes it comes from the compression on the pec minor muscle. So I want to show you how to release and stretch that muscle so it allows for the positioning and the freedom of the nerve and vascular supply to your arm. Please consult your medical doctor or physical therapist before beginning any exercise to make sure that it is appropriate for you. So to find the pec minor muscle, what I want to do is just feel the bone on the top of my shoulder. That's going to be my acromion. So then I want to find my collarbone. So you've got your collarbone. If you follow it down, it'll start to come to a pretty pronounced dip. Find that biggest dip on the collarbone and then drop down. When you drop down, you're going to be in a cave, so to speak. And I want to then try to find a bony portion. And right there is my coracoid process. That's where the pec minor muscle is attached. It originates there. So that's going to be where I'm going to locate the origin of this muscle. There's 3 ligaments and 3 muscles attached there. Sometimes it can be really tender, so I'm just locating where it is. And then it's going to attach into ribs 3, 4, and 5. So going back to your collarbone, the first rib is hard to palpate or feel. It's right under there. So you can come down to the second rib. So the first rib that you can really feel is going to be your second rib, and then you want to drop down to 3, 4, and 5. So you'll start to feel maybe some change in tenderness in those areas. That I'm on my pec minor muscle. Now it's under the pec major muscle, so it's going to be deep, but usually you can find that it's tender if you have had a forward posture, or if you inhale and you're a shallow breather and you're really pulling the air in, that muscle is going to contract to do that. So one way that I'll also find it is going underneath the pec muscle and then feeling into that area. So you can go along the rib cage there. But mainly I just want to go down my collarbone, find where the dip is, find the coracoid process, that bony prominence just where the attachment is. And then I'm going to kind of go down at an angle and follow that downward. And I'm going to run right into the muscle belly of my pec minor. And once you find that, you're going to seek for areas of tension or tenderness. Those are the trigger points. And if they reproduce the pain on the front of the shoulder, then you know that you're in the right location. So what I'll do is I'll use a single lacrosse ball, and I'm going to place it right over that area. There's different ways that you can release this. If I'm going to do this on the floor, what I'm going to do is lie onto this and put pressure with my arm out at 130 degrees abduction, so just out to the side. So on my left side, I'm going to show you where that placement's going to be. I'll be on my stomach. Find that, locate where the pec minor is, take my lacrosse ball. I'm going to rest down onto it and then take my arm and bring it into 130 degrees of elevation or abduction out to the side, resting my forehead. And then what I'm going to do is I want to go kind of perpendicular to the muscles. So to do that, I'm going to just bring my shoulder blade up and in and then loop down and out. So up and in, down and out, or just go diagonally back and forth over some of those fibers, and you'll probably be able to feel them quite well. And I want to work on that. You can hold on an area for 20 seconds to release the trigger point, but I usually work on the muscle and fascia for about 2 minutes. Now, putting pressure lying down on the floor, sometimes that's not a good position for some folks, so you can do this up against the wall. To do it against the wall, I'm going to find the same location, but then I'm going to take my arm and I'm going to bring it out to the side, and I'm going to turn my head to the opposite direction
and gently go side to side. Or again, I can go into that diagonal movement, but I'm just slowly investigating and moving across those areas. After I have released the pec minor muscle, I then want to stretch this muscle. And to do that, I like corners to do this in to begin with. So I'll take my elbows, rest them on the wall, and lean into the wall, and you should feel the stretch. I can also take my arms and bring them up slightly and lean into the wall this way. But I like to start with the elbows at shoulder height, leaning in and holding that stretch. Now, as you hold that stretch, if you do have thoracic outlet syndrome, your hands can start to tingle. You want to come out of that and then let the tingling subside, go back in and hold again. And then as the pec minor becomes more extensible and releases and you've got more length in that area, then you may have less and less tingling in the hands. And that's a good way to address thoracic outlet syndrome, is to open up and stretch and release that pec minor muscle that's pressing on that nerve bundle. So again, if you're getting shoulder pain on the front side, or you're getting pain that's going down into the pinky side of your arm, sometimes it's coming from the pec minor muscle. If you don't take deep breaths, or you're doing a lot of forced inspiration, that's going to bring the shoulder blades forward and down and pulling the air in, so those can become tight and restricted. That is the pec minor trigger point release, and I hope this is of help. Have a blessed day. Thank you.